Myself, Dr. Devaraj K, an associate professor in Department of Head and Neck Surgery, Kasturba Medical College, Manipal. Today, let's understand a bit about thyroid neoplasm. Thyroid gland is an endocrine gland located in the lower part of the neck, just below the larynx, that is the voice box, and in front of the trachea, which is also called as windpipe. Any abnormal growth or tumor arising from this gland is called as thyroid neoplasm. These neoplasm could be benign or malignant. Most commonly, these neoplasms are benign in nature. The thyroid adenoma is the most common thyroid neoplasm to be seen in clinical practice. However, 5 to 10% of the thyroid neoplasms could be malignant, and this include most commonly the differentiated thyroid cancer like papillary carcinoma thyroid or follicular thyroid cancer. At times, thyroid cancers can be very aggressive in the form of anaplastic thyroid cancer. Let us look into how the evaluation of the thyroid neoplasm takes place. The evaluation of the thyroid neoplasm starts with a basic medical history taking and a detailed clinical examination. After a thorough inquiry about the onset of the swelling, the duration of the swelling, and the associated symptoms like voice change, breathing difficulty, or even swallowing difficulty, a detailed clinical evaluation includes examination of the neck, including thyroid gland and the lymph nodes, and the examination of throat for any abnormalities in the larynx or vocal cords. After a thorough clinical evaluation, the basic investigations in a thyroid neoplasm case will include hormonal assessment in the form of thyroid function test, followed by an ultrasonography. This ultrasonography will help us characterize the lesion and understand the nature of the lesion if it is having any suspicious features. Most of the suspicious nodules will then undergo fine needle aspiration cytology, in which a small needle is introduced into the thyroid gland and the nodule, and a sample is taken for microscopic examination, which will help us understand if the lesion is cancerous or not. Now, what are the treatment options available for thyroid neoplasm? Most of the thyroid neoplasms eventually will require surgical excision. Obviously, the nature of the lesion, the number of lobes involved by a lesion, as well as the patient's preferences and his or her general well-being, the treatment is decided. The available options for thyroid surgery are either hemithyroidectomy or total thyroidectomy, in which the whole of the gland is removed. Several factors will be considered for making this decision. A multidisciplinary team consisting of endocrinologist, surgeon, and oncologist will get involved in this decision making along with the patient. The factors considered for this decision include type of the cancer, the stage of the cancer, the patient's general well-being, and his preferences. It is crucial to undergo regular follow-up after undergoing thyroidectomy for several reasons. It not only enables early detection of the possible recurrence, but also ensures smooth recovery of the patients who has received cancer treatment. The frequency of follow-up for thyroid neoplasm after undergoing treatment varies from that of other cancers of head and neck region. After the surgery, 3 monthly follow-ups are done in the first year, 6 monthly in the second year, and yearly after that. However, this may vary from patient to patient depending on the type of cancer and its aggressiveness. Now, let us look at the recent developments in the field of treating the thyroid neoplasm. Recent advances in surgical techniques in the form of robotic surgery for thyroidectomy, as well as availability of intraoperative nerve monitoring, have enabled to perform more safer and effective thyroid surgeries. There are several misconceptions related to the thyroid neoplasms as well. Let us look into 3 or 4 of such misconceptions. The first one being that the thyroid neoplasm is only seen in women. The truth is, the thyroid neoplasm, though is common in women, it can also happen in men. The second misconception being that all the thyroid neoplasms can be treated by medical treatment. The truth is, several of these cases require surgical intervention. On the other hand, there is also a misconception that all the thyroid neoplasms require surgical excision. No, the nodule is small and non-progressive. The surgery can be avoided and the patient can be kept under close follow-up. There is also a misconception that if there are no symptoms related to the thyroid gland, the medical management in the form of hormonal therapy can be avoided. However, it is not true. The thyroid hormone is essential for the bodily function. Particularly, the thyroid hormones are essential for optimal functionality of the heart and brain, and it is essential to keep the thyroid hormones in the normal limits, which might at times require taking medications. Thyroid neoplasm is not uncommon in clinical practice, but not all thyroid neoplasms are malignant in nature. However, this can only be verified by a qualified medical practitioner. That means every person with thyroid nodule should promptly seek medical attention as early as he or she can. Thank you.